Los Angeles is home to millions of people looking for a healthier lifestyle. Well, look no more. Your World Today is here and is a show offering you a wide array of topics to improve your quality of life. From a healthier living to making smarter decisions. Welcome to Your World Today.
Hello and welcome to Your World Today. My name is Ofelia de la Torre. I'm so glad you can join us today.
And I'm Kerrigan Von Pulley, and we are excited to have you with us.
So I see you're sitting straight. Is that because we have a special guest?
We do, and he's watching, and he's a spine specialist, so he wants to make sure that our spines look good.
So we're with Matt Chong from White Memorial Medical Center. He's a spine surgeon. Welcome to the show, Doc.
Thank you very much.
So glad to see you. He does the Spanish version very well. So we'll see how your English is.
Hopefully just as good. We'll see.
Okay.
And let's not switch to Spanish, because I'll get nothing out of it. So.
Okay. We'll keep it with Shakespeare. Doctor, what is stenosis?
So stenosis, it refers to a condition where the space for the nerves as they run through the spinal canal all the way down the neck into the low back, that space gets compromised. It becomes smaller than it normally is. And when it exceeds a certain level, it can start to pinch the nerves and start to cause symptoms. How
prevalent is this ailment?
So it's a common ailment, and probably one of the most common things that I see in my office. The vast majority of stenosis cases are related to the degenerative and arthritic changes that you see over a lifetime. And so in the elderly population, especially, we're talking patients as they get into their 50s and 60s and beyond, a lot of them can suffer from this condition as a result of the arthritis that's built up.
You know, a lot of people will think they have a little pain in their lower back and I'll just tough it out. What's the point where the symptoms get too strong or too severe and you want to see a doctor about it?
So I'm going to talk about low back or lumbar spinal stenosis today. And really, there are some typical classic presenting findings that people should stay abreast of, should be aware of. And these findings usually do necessitate a visit to the doctor to start the workup and kind of see what's going on and what the treatment may involve. The classic symptoms we're talking about usually related to upright activity, specifically walking or standing. And what we mean specifically is patients commonly, as they stand and walk, start to experience pain that radiates from the low back into the buttock and down the legs. They can also experience numbness that radiates down the legs. And many times they endorse this history of some weakness and heaviness in their legs that prohibit them from walking a far distance. And what you see very commonly in stenosis patients is that because of these symptoms, the pain, the numbness, the weakness in their legs, their walking capacity gets less and less and less over time. And most commonly I ask my patients, you know, compared to where you were 2 years ago, a year ago, 6 months ago, how far can you walk comfortably now before you have to sit, before you have to take a break?
Is there any stiffness involved in some of these symptoms?
Yes. So very commonly, the stenosis is a result, as I referenced, of arthritis in the spine,
right.
Worn out discs and arthritic joints, and all of that can be a stiffening process in the back. And so it's kind of a double whammy in the sense that the back gets stiff from the arthritic changes, and then also the nerves can start to get pinched and produce this stenosis.
Carrie, I have so many questions. I'm sorry. I have friends that are all messed up, and this weekend I had some friends over, and the lady friend, she's walking like a penguin. She's got like lumps in her buttocks, and she's got a stiff neck and can't stand a massage. She should go see you, right?
Well, so many times stenosis or lumbar spinal stenosis is not a disease entity in and of itself.
Okay.
Very commonly it's in conjunction with other things. A lot of times people are coming in with tight muscles, muscle spasms, muscle knots. And you know, the technical term we use is myofascial syndrome, but really it refers to aside from arthritis, which can affect joints and discs, we can see strain and sprain in our muscles, in the ligaments, in the capsules overlying the joints.
Can stress do that to you, doctor?
Stress can do these things, yeah.
I knew it.
And you said that it's usually something that comes with age. What are some things that you can do to maybe prevent it or to make it less severe? I mean, are there preventative measures that people can take?
Yeah, so really the standard of care to start with, the conservative treatment I always like to start with is physical therapy. The key is really, in the physical therapy, it's twofold. It's to maintain as much flexibility that we have in our back to avoid those twisting, stretching, sprain, strain type injuries and minimize episodes of things like sciatica and things like that down the road. But also it's to build core strength. It's to strengthen our abdominal muscles, our back muscles, to maintain a good posture when we sit, when we stand, when we walk, and live our everyday life.
Doctor, not that it has anything to do with me, but do well-endowed chests have any impact on your spine? It's not funny, it hurts.
Yeah.
You know,
so,
there's...
Absolutely, yeah. So there is definitely a correlation between that and having episodes or increased episodes of back pain. But a lot of it, again, goes back to that core muscle strengthening. It's in trying to maintain as good of a posture as possible by strengthening all of the muscles we have that support our back.
So then exercise is...
Absolutely, absolutely.
But then it also sounds like with exercise, proper stretching, and make sure you're limber before you pull anything.
So always a combination between stretching and flexibility with the strengthening. Yeah.
Wow, Dr. Ike, I want to keep on talking to you, but we have to go on a commercial break, but we'll be right back and we'll continue our very interesting conversation with Dr. Chong. Do you have questions about your health insurance coverage under Obamacare? Are you confused about Medi-Cal and Medicare dual coverage? Are you worried you won't be able to keep your doctor? Our friendly counselors at White Memorial Medical Center's new Community Information Center understand your concerns and can enroll you in coverage that meets your needs. We are here Monday through Friday to answer all of your questions. We invite you to come and visit our Community Information Center at White Memorial and let us help you. Thank you for being with us. This is Your World Today. I'm Ofelia de la Torre.
And I'm Kerrigan Von Poli, and we're here with Dr. Matt Chong from White Memorial Medical Center Spine Institute.
So we've been talking about stenosis and what that is and how we get it and how we fix it and all that stuff. Doctor, thank you for being with us. So how does exercise impact our health with our spine?
So I think two key points are, number one, it's the preventative effect of doing things like physical therapy and strengthening and flexibility, but also the treatment effect. So in terms of the preventative effect, by strengthening our core muscles, our trunk, our back, by improving our posture during everyday activity, and by maintaining our flexibility, we really minimize the chance of back injuries in the future, whether it's spraining or straining your back, whether it's an episode of sciatica, whether it's herniating a disc. In terms of the treatment effect, we find that very often by doing those same exercises with the core strength, the flexibility, and the stretching, that we can actually treat some pain, numbness, tingling, weakness that people have as well.
Did you just say that you can treat pain with exercise?
Yes.
That's huge. I mean, and people don't know that this is in fact true, that you can do exercise and get rid of back pain.
Well, and absolutely. And what I see commonly in my office is that there are a lot of patients that come in that may not have had things like physical therapy. And really, we're talking about organized physical therapy at an outpatient location. It's a prescription that we usually provide.
Yeah, because if you leave it up to us, we're going to say, well, tomorrow we'll do it, right?
Right. Well, we put it off. It tends to happen.
Yeah.
But we find that very often, by doing the physical therapy, patients state that they have some pain improvement, and then actually they choose to defer on any further treatment or workup of their condition because of the improvement.
And it's not just the exercise, but it's doing exercise the right way, correct?
Correct. So I always stress it's doing it the right way and doing it with regularity.
So doctor, having said that, let's do it the right way, let's put it to the test. And
sure.
What better person than my good friend Carrie?
I always seem to be the guinea pig in this situation, but
I know, I'm sorry.
I'm happy to do it.
I have the high heels.
I know,
so.
I'm going to wear high heels, so I don't have to do it.
All right.
But I'm going to go over here and do some exercises.
Yes. Thank you, Carrie. So right now, Carrie's getting some exercises. Now, what are the possibilities of getting your health, your spine health back if you have arthritis and all these other, like sciatica, which is huge. Most people have a bout of sciatica in their lifetime.
Sure.
How does that impact them?
Well, I think the key, and I think sometimes where patients may get a little distracted, is many patients come into the office focused on X-ray findings, on MRI findings. I have a disc bulge here, it says I have a pinched nerve here. And really, as the spine specialists, we really try to refocus the patient on their symptoms, symptomatic improvement. How do we get them to a better quality of life? And really, our more aggressive treatments, whether it means doing steroid injections in the back or even an operation down the road, really that's contingent on a patient's symptoms, more so than just a isolated finding on an X-ray or an MRI scan.
Okay, doctor, thank you. I think Carrie and Robert Rose are ready, so we can see what those exercises entail.
Thank you, Ophelia and Dr. Chong. And now I'm here with Robert Rose of robertrosefitness.com. Robert, you're going to show us a few exercises that are low impact and that anybody can do at home, I guess.
Correct. Yep. No special equipment needed. We're just going to start off with some simple exercises in the chair. I'm going to be sitting down. I'm going to have good posture, straight up and down. My abs are tight. What I'm going to do, balance myself with my hands. I'm lifting one leg up and down, lifting one leg up and down. Then we do the same thing with the other side. Lift, lower, control up, control down.
Where is that lift coming from? Is that from your legs or from your abs?
It's from your abs, part of your lower abdominals, part of your hip flexor muscles, everything there in the core. A more challenging version, I'm going to take my opposite elbow, opposite knee, slight rotation here, just through a comfortable range of motion. I don't want to go beyond and twist my back into anything that's too contortionist or anything like that. Then another more challenging version, again, I'm kind of bracing myself with my hands, lifting both knees up and down, and down. Ideally, anywhere 10 to about 20 repetitions of these, 2 or 3 sets of each exercise.
And then how often, frequency-wise?
Minimum 2 times a week, ideally 4 to 5 times a week would be optimal for that.
All right.
And then we're also going to do a couple exercises here.
Yeah, I see the mats here. I know we're going down.
Yep, we're going to do
something down here.
We're going to do a few exercises here.
Okay.
I'm going to give, again, a basic version and a more challenging. First one we're going to start off with is just a plank. So I'm starting off on my knees, my body's staying nice and straight, squeezing my abs tight. My butt's not way in the air and I'm not drooping down. My elbows are directly under my shoulder. I'm going to hold this for about 30 seconds. Now, if that's easy, I can make it a little bit more challenging. I'm going up to my toes, again, squeezing my abs tight, my body straight. We can also do the same exercise to the side. Again, my elbow is directly under my shoulder. My body is staying straight. My bottom leg is bent. To make it more challenging, I'm going up onto my feet like that.
All right.
Again, ideally, we're going to try to do about 30 seconds for each exercise. If you can do more, that's great.
And then again, how many times per week are we looking
A
to
minimum
do that?
2 times per week, ideally 4 or 5 times per week.
Now, do you have to have a mat at home to be able to do this?
No, you can do this on the carpet. You can do it on a beach towel, anything that's kind of cushioned under your elbows.
The mat doesn't give the power, it's you.
Correct.
Okay.
That's just cushioning your elbows.
All right, very good. So with a chair and a mat at home, it looks like you can do some great exercises, low impact. Again, Robert Rose has shown us some great things to do at home, robertrosefitness.com. And we're going to toss it back over to Ophelia.
Wow, thank you, Carrie and Robert Rose, for those great exercises, doctor. So you're right, they were talking about that.
Absolutely, yeah. And those are a great set of exercises to do every day at home.
So the core is crucial.
Correct.
What can we do at home to, if we can't get to the gym, or how shall we use our posture?
So I think a couple of key points, and really I think it's common sense, but people forget.
Right.
And they need to be reminded, is there is a way to maintain what we call good back hygiene, and it's trying to minimize, again, those risks of back injury, of throwing out your back. A couple of key points. Number one is the way we choose to bend.
Right.
So very commonly we see patients in the office, they come in and we ask them to bend and they go like this down to the ground pretending to pick something off the floor. And really that's not the best maneuver for the back. The best way to bend is really to bend through our knees and try to maintain as upright of a posture in our back as possible.
Great.
Now, inevitably, we end up having to bend a little bit, but we try to maintain upright posture and
Right.
bend through the hips and
All
the
right.
knees.
Well, thank you for that advice, doctor. I'm going to use it every single day if I don't forget. Thank you for being with us, doctor. We're going to go to a commercial break, but we'll be right back. So don't go anywhere. This is Your World Today. Do you have questions about your health insurance coverage under Obamacare? Are you confused about Medi-Cal and Medicare dual coverage? Are you worried you won't be able to keep your doctor? Our friendly counselors at White Memorial Medical Center's new Community Information Center understand your concerns and can enroll you in coverage that meets your needs. We are here Monday through Friday to answer all of your questions. We invite you to come and visit our Community Information Center at White Memorial and let us help you.